The Centers for Disease Control and Prevention, once the world's gold standard for public health, now faces a crisis that threatens us all. In just 6 months, the CDC has lost thousands of employees, had its budget slashed, and seen its authority gutted. This isn't bureaucratic drama, it's a national emergency. The agency that once protected us from pandemics is now barely functioning. Our global disease defense network is in tatters, leaving us exposed to threats that can cross continents in hours. The collapse of the CDC affects everything: your children's safety, your hospital's stability, even the economy. With experts gone, a void is filled by political agendas, not science. Who will track outbreaks, ensure vaccine safety, or investigate rising infant mortality? The answer, terrifyingly, is no one. We are dismantling our own defenses by choice, not by accident. This is a slow-motion disaster, and it puts every American at risk. The CDC is losing its best and brightest at an unprecedented rate. Since Health Secretary Robert F. Kennedy Jr. took office, the agency has become a shell of its former self. Top scientists and leaders like Dr. Dimitra Daskalakis and Deborah Howry are gone, taking decades of expertise with them. This isn't just a leadership change, it's the erasure of institutional memory. You can't replace this knowledge overnight. The CDC's ability to respond to outbreaks, coordinate with states, and communicate life-saving information is crippled. The message to scientists is clear: expertise isn't valued, and evidence-based policy is expendable. As more experts leave, fewer remain to analyze data or develop strategies. We're making ourselves blind to the very threats the CDC was created to fight. This is reckless, and the consequences will be felt by all of us. The playbook for public health crises has been thrown away. Right before the next big game, we're flying blind into the next emergency. The hollowing out of the CDC has real tragic consequences. In Mississippi, infant mortality is rising after CDC-supported programs were defunded. Hospitals are left without critical support, making them vulnerable to outbreaks. Imagine a new flu strain this winter. Without CDC guidance, hospitals could be overwhelmed. Globally, the collapse of CDC and USAID programs is fueling a surge in diseases like tuberculosis. A recent study projects millions of additional TB cases and deaths worldwide due to these funding gaps. Diseases don't respect borders. By letting them spread abroad, we invite them home. In Cambodia, TB case detection has plummeted, leaving hundreds undiagnosed each month. These are the direct results of our own policy choices. The experts who warned us were pushed out, and now we're living with the fallout. We're choosing to let diseases fester, and the cost will be measured in lives. How did we get here? Politics, not science, is driving the CDC's collapse. Health Secretary Kennedy has undermined the agency, questioned vaccine safety, and slashed funding for vital research. Science is now secondary to political loyalty, creating a toxic environment where facts don't matter. Staff are afraid to speak up, and critical research is being shut down over baseless fears. The NIH has cut international collaborations and suspended essential TB research, stalling progress on new treatments. This isn't reform, it's an ideological crusade that endangers us all. Public health decisions should be based on evidence, not conspiracy theories. We're trading world-class expertise for political whims. The result? We're less prepared, less informed, and less safe. This is a recipe for disaster. We're actively choosing ignorance over safety. The attack on the CDC isn't just a health crisis, it's an economic one. Budget cuts will eliminate over 40,000 public health jobs nationwide. These aren't just federal jobs, they're the people who keep your community safe. The economic impact is massive. Billions lost, local economies weakened. Public health is an investment, not a drain. Preventing outbreaks saves money and lives. Weakening the CDC undermines the stability businesses rely on. We all saw how unchecked disease can shutter schools and disrupt supply chains. A strong public health system is the foundation of a strong economy. The current policies are a false choice between health and prosperity. They're linked. The bill for this short-sightedness will be paid in dollars and lives. We're gambling with our future for political points. The CDC has been gutted, its experts driven out, and its credibility shattered. Our country is more vulnerable than it's been in generations, but we can't afford to look away. Stay informed. Seek out credible, evidence-based information. Support a strong, independent public health system. Speak up when science is attacked or experts are silenced. Demand that leaders restore funding and let science guide policy. Hold them accountable. Ask what they're doing to protect our health. This is not a drill. The CDC's dismantling is a crisis for everyone. We can stand by or we can demand a course correction. For all our sakes, let's choose to stand up.